Well, a very good morning to you, Oliver, and Happy New Year to you once again. Well, I do have the acting health MEC here in the Eastern Cape, Umama Ubukuwe Fanta, who has come here to see and monitor at Frere Hospital the delivery of babies. I can tell you now that at least 61 have been delivered since the new year, and one was delivered at around just after 12 o'clock. So Frere Hospital is quite busy, as even though 6 have been born here, but across the province, 61, and mostly comprising of females. Let's bring in the MEC, whom you can see has been here waiting for us, holding a baby there. Ma'am, thanks a lot for your time. Happy New Year. I see you are monitoring the delivering of babies here in the Eastern Cape. Kindly take us through that.
Thank you very much, Msasaz, and your listeners. We are here today welcoming the newly borns. We praise the Lord. In the province, we've got 61, 38 girl children and 23 boy children. The first one is a boy child in Nelson Mandela. We welcome, what worries us the most is the young girls that are the mothers now. But we are trying to motivate them to go back to school so that they take care of the kids. But we want to appeal to boy children and men in our country to stop sleeping with our young girls, because they are giving burden to the girl children. They are alone here now with pains. They are nowhere to be found. So we want to appeal to men to stop sleeping with girl children. The statistics indicate that we've got 15 to 18 years girl children in the province that had newborn kids, and it's not acceptable, and it's worrisome. But we praise God because umntana is a blessing. Before you were born, I knew you. Baziwe nguThixo, but we're not happy at the same time. Kodwa ke siphila ngezwi kaThixo elitshoyo esithi dingeka kubumbe isizalo sikonyoko ntikwazile.
Where in the province is this commonly rife, MEC, this issue of underage pregnancies? And I understand the Alfred Nzo District is one of them. And what programs do you have in place to ensure that this message does go through those young children?
Thank you very much, Sasa. Most of them are from Alfred Nzo, and we're not comfortable. Both social development and education, we've got clear programs of life skills, especially the girl children. We've got girls empowerment programs, we've got boys empowerment programs to make sure that these young girls and young boys, they refrain from sexual activity because they end up with babies that are not planned. So clear programs, and we must up our games in making sure that it's not going to be the government only, even communities. Churches must play a role when it comes to preaching that the abstinence is especially to young ones. And law must take its course. If its course, especially if a child is less than 18 years. There must be someone who is in jail for that. Because that's rape. South Africa, sleeping with that less than 16-year-old, it's a rape. And unfortunately, no one is in jail because of these cases. So I want to appeal to parents not to hide these cases and don't treat as a family member. It's if a 14-year, 15-year-old is pregnant. That's crime. That's statutory rape.
Thank you so much for your time, MEC. That was the acting health MEC here in the Eastern Cape, Oliver Dixon Bukiwe Fanta, painting us, even though they are celebrating these newly born babies, but of concern is the issue of young children falling pregnant and males not playing their part, and saying that the Alfred Nzo District, where the Premier Oscar Mabuyane is currently at now, visiting various hospitals and doing the same thing as she is doing here, that's of concern, that young children are falling pregnant and that ruins their lives going forward, and then they become a burden to government. So she's sending that statement message even to families that if there are issues of statutory rapes, parents and communities should report them to law enforcement agencies so that this serves as a deterrent.
Bongle, thank you so much for that. Really do appreciate it. Bongle Yankees there in the Eastern Cape.